Hello, I'm Diane Newman. I'm a nurse practitioner and I specialize in urology. And I see patients, men and women, with pelvic floor problems, urinary incontinence, overactive bladder, and other lower urinary tract symptoms. I've been practicing in urology for over 35 years, most recently at the University of Pennsylvania in Philadelphia. Men with BPH will have a slow stream, and they'll tell you, my flow's not as good. Some of them even tell me, I can't hit the toilet bowl anymore. I kind of just dribble, and the stream is really weak. But with overactive bladder, men will have urgency and frequency, and sometimes urinary incontinence. And what I find is that once we treat men for their prostate, because BPH is when the prostate enlarges, so we give them something called an alpha blocker or some other medication that helps shrink the prostate. They remain with overactive bladder because overactive bladder symptoms are bladder symptoms, not prostate symptoms. If you're a healthcare professional, I want to give you some information on Gemtesa, which is indicated for men and women, for men with BPH and overactive bladder symptoms of urgency, frequency, and urgency incontinence. But it's really the first and only beta-3 agonist that has no clinically significant impact on blood pressure. As far as prescribing with patients who are on other medications, the only concern is someone who's taking digoxin. You want to monitor those dig levels prior to prescribing Gemtesa. Gemtesa does not have any contraindications with other drugs that are metabolized through a certain pathway called CYP2D6. And listen, there are many drugs that are metabolized through that pathway. There's no titration. It's once daily dosing, which is great. Patient can take it any time of day with water, or something to drink. They don't need to worry about any interaction with food. But you can also crush it, maybe an older adult who doesn't like swallowing a pill. You can crush it in applesauce and take it with water. Since I started prescribing Gemtesa, I've really seen some great outcomes with patients, especially men with BPH and overactive bladder, symptoms of urgency, frequency. They tell me that, they're going to the bathroom less. The urgency is not as intense. They were able to wait longer, which is a really important thing, especially in active men. And I have a lot of men who are, in high-profile jobs or out there working in construction in different areas that they don't always have access to the bathroom. So Gemtesa has really helped them. Patients with overactive bladder will ask me after I prescribe medication like Gemtesa, well, how long will this drug work? And what the research showed is that they did it over 12 weeks, and they showed that there was improvement over that 12-week period, but it also persisted up to 52 weeks. And what kind of improvement should you expect? Well, let me tell you a little bit what I hear from my patients. They'll tell me that they're not going to the bathroom as often, and they'll notice that maybe they have time. They're sitting in a meeting and they'll say, well, that urgency is not as strong. I can wait till the meeting's done, or call, maybe I'm on a really important conference call, I can wait. They have more time to get to the bathroom if they're out and about doing some activities. And also I hear things like, people will say with urgency, honey, I gotta go. That gotta go, hurry type of feeling is gone. The other thing I hear is that since Gemtesa works on the bladder to try to get it to hold more urine, patients will tell me that they think they're voiding more urine, that there's more urine per void when they go to the bathroom. Gemtesa has many resources. There's a set tracker to help you stay on track as you start your Gemtesa. There's also starter kit where you can learn more about Gemtesa, how to take it, some contraindications, what you should expect from taking this medication. What I tend to do in my practice is I ask them to do a diary, a bladder diary, which tracks their toileting habits, how often they go to the bathroom, whether they have urgency, whether they may leak some urine, have urinary incontinence. And I have them do that prior to going starting treatments such as Gemtesa, and then I track their improvement with a diary. This is very helpful. Diaries are used a lot, like people use food diaries in weight loss programs. And I think it may be helpful to help your patient track their improvement by doing a diary, because with Gemtesa, you're going to see a decrease of bladder symptoms such as urgency, frequency, and incontinence. So I hope this has been helpful, and I hope you feel pretty confident about prescribing Gemtesa for overactive bladder symptoms of urgency, frequency, and urgency incontinence.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see full prescribing information.